Hello, and welcome to the Walpole Business Spotlight Show, brought to you through the efforts of the Walpole Chamber of Commerce and Walpole Media TV. My name is Harry Brusades, and I'm the president of the Walpole Chamber of Commerce, and I'm honored to be your guest today. The show, and the mission of the show, is to bring into spotlight local businesses and sales professionals so the general public can get to know these businesses and what their products are all about or their services, so they can make sound, educational, and knowledgeable decisions in their buying choices. Today, my guest is Walpole VNA, located in Walpole, Mass. And my two guests specifically are Elaine Stevens, who is the executive director, and Amy Kelly, director of marketing and business development. Thank you very much for being on the show today.
Thank you for having us.
So I'd like to read something directly from their website and talks a little bit about the history of Walpole VNA. And I thought it was a very good piece, and I thought it should be read. So if you can just give me a moment. So something about the Walpole VNA. It was started in 1909 with $500 from the Walpole Women's Club. Mrs. Emma Newcomb was hired as the first nurse for Walpole VNA. She traveled throughout the town on foot, bicycle, or on trolley. One night in 1913, with no doctor available, she delivered 3 babies on her own. That year, she made over 1,024 house calls. And in 2013, Walpole VNA made close to 30,000 home care visits in 23 towns around Walpole and the surrounding community. So I think that's just incredible. And let's go right into talking about what the Walpole VNA is and what they do.
Well, the Walpole VNA is a home health agency, and we provide nursing, physical, occupational, and speech therapy, home health aides, social workers, to people who want to recuperate in their own homes, who want to stay in their own homes if they become ill, and that's our whole mission. In addition to that, one of the unique things that the Walpole VNA, or two of the unique things that the Walpole VNA does, is that they have they provide for the city of Walpole all the public health programs and services. And so we're really privileged to work with the city of Walpole to provide immunization clinics and services for the children and adults of Walpole, to monitor communicable diseases, and to be part of Walpole's emergency planning. We also provide very, very unique for home care agencies these days, pediatric services, maternal and child health services for newborns, and we do serve some sick children with nursing services. And home health agencies, especially visiting nurse associations around the state, have a long, beautiful history of doing everything from delivering babies to the other spectrum of caring for people as they're dying, or getting what they need to stay in their homes throughout their lifetime.
Wow, amazing. And tell me a little bit about yourself, Elaine. Where are you from?
I'm from Milford, Massachusetts.
Excellent.
I'm a Boston girl, went to Boston College, and I went to Boston University Medical School for a master's in public health, so I'm a Boston girl. And I'm really proud to be here in Walpole.
Excellent. And where were you before you joined the Walpole VNA?
I spent 25 years running a large VNA affiliated with 4 hospitals in Rhode Island. Okay. And I served on the National Association for Home Care and Hospice's Board of Directors, and then spent some time working in Washington, D.C. for the National Association.
Excellent. So what is your role, I guess, on a day-to-day or week-to-week basis?
So on a day-to-day basis, I'm responsible for the oversight of the programs and all of the different businesses, the business things that have to go along with running a home care. We have an electronic medical record. Obviously, we have to do a lot of billing of insurances. We have a marketing and business development area because we want to grow and provide care and service. We do some fundraising. So a lot of my responsibilities are the administrative and supporting most of our staff. 80% of our staff are out in the field delivering care, supporting them, finding ways to make it so that they can do what they do 24 hours a day, 7 days a week, 365 days a year. A lot of people don't know that about home care, but it's like a hospital without walls.
Absolutely. All right. And also, Amy, Kelly again, Director of Marketing. Where are you from?
Originally, I grew up in the Brockton area,
Okay.
also a Boston girl, educated and spent most of my younger years in Boston, and am now the happily married mother of 3 on the Cape. So
Excellent.
I do commute up from the Cape, but for Walpole VNA, such an outstanding reputation, definitely worth the ride.
What town down the Cape?
I live in Pocasset.
Oh, nice. Very nice. So you don't have to get away for the summer. You're already there.
I don't, yeah.
Nice. Excellent. So tell me about the marketing and advancement of Walpole VNA. What are you doing there?
I'm relatively new, so we have a lot of great plans. One of the most important things that we're looking at is outreach. So we want to be able to reach as many patients and let them know that home is an option. We do that through area councils on aging, chambers of commerce, the opportunity to meet with physicians, patients coming out of nursing homes, Boston hospitals. Basically, any patient who's had a hospitalization and needs help at home is a patient that we're able to service. So we encourage anybody who's been in the hospital or is having challenges at home, has a parent that's having challenges at home, to reach out to us so that we can meet with those people and see how we can help.
Okay. Excellent. So in doing some research on the Walpole VNA, I noticed that it is a nonprofit.
Yes.
All right. Are all VNAs nonprofit?
Well, they used to be.
Okay.
Most VNAs are nonprofit. Not all home care agencies are nonprofit. Home health and hospice providers can be either nonprofit or not-for-profit. All of us are regulated by the federal government and the state government in which we serve. In the case of Walpole, a proud history of being nonprofit. We have a wonderful board of directors, all of whom live and work in the Walpole area and take very good care of making sure that the investment that Walpole has made in this association is well, that the money is well spent, and that we're doing the kinds of services that we need to do to meet the needs of the people in Walpole. Sheila Ahmed is our president. She does a great job of just bringing this board of directors together so that we can make sure that what we're doing represents the needs of the community.
So is the town of Walpole funding the Walpole VNA to a certain extent as well?
We have a contract with the town of Walpole to provide those public health services that I talked about earlier. Yep. So the town of Walpole does support a nurse to be working at the town hall with the health agent and the other people at town hall to actually be working to do some of those services. Mm-hmm. So we do have a contract with the town of Walpole to provide some of those services, and some of them are provided just as part of our mission.
Okay. And you are also actively looking for volunteers or donations to the VNA as well.
Yes, we have some wonderful volunteers that come in regularly to help us with everything from filing to an Alzheimer's support group. We have an Alzheimer's support group to working at some of our clinics. And in terms of donations, we've been very fortunate over the years. Former patients, families, and people. We serve 23 communities, and people have been extremely generous in helping to support the services that we provide. And we couldn't do some of the outreach work and the work for patients whose insurance doesn't cover all that they need, mm-hmm. or who don't yet have been connected with insurance if we didn't have those donations.
Okay. So let's talk again a little bit more in detail as far as the services go. Mm-hmm. Because for myself, being in the financial services world, a big topic or talking point in financial planning is long-term care insurance. So just knowing a little bit about Walpole VNA, my first thought was, okay, somebody is in need of care. The visiting nurses are coming in and helping those people with those 5 assisted daily living needs. Mm-hmm. And that can be something like moving a person or feeding a person or helping them to the bathroom, etc. So, and that's not what this is about. This is more about the nursing aspect of skilled services that you're talking about, which you could receive in a hospital, but you're getting them at home. So first off, the people that are doing and going into the family's home, they are actual nurses.
Yes, but we
Okay.
do we do some of both, and what we do is nursing, the therapists, physical, occupational, and speech therapy. We have social workers. We do have home health aides. Primarily what we do are for people who are in what we call an acute need. They just got out of the hospital, they had a wound, they had surgery, they had a knee replacement. We do a lot of knee replacements, hip replacements. But we also provide for their daily needs through home health aides. Now, your insurance covers different things. And so when you come out of a hospital and you have a need for a nurse and a therapist, and let's say you had a hip replacement and a home health aide, we provide that. Once you're stabilized, if you still continue to have some needs, your insurance may not pay for that. Medicare may not pay for that. So what we do then is we connect you to HESCO or to other services, either through the state or privately, that can pick up where we left off to sort of maintain you in your home, if that's what you want to do. So our whole goal, though, is to keep people at home where they want to be, and not to have to be institutionalized if they don't need to. And one of our big focuses these days are rehospitalizations. We're really focused on keeping people from having to be rehospitalized, and we're working real hard with physicians and physician groups to do that.
So I think a big priority for anybody making a decision on who they would have come into their house. So if it was me and my mother needed some type of care, I'd want to be absolutely certain that the people that are going to my house have been vetted properly. Talk a little bit about, the background checks, the vetting process, the experience of these skilled workers that go in.
So we fully vet all of our workers in compliance with the law and beyond that. So criminal background checks are always done. That's a requirement of the law for anybody that we employ that's going to go out into a clinician's home. We also do medical checks, things like communicable disease checks, and making sure everybody's up to date on their immunizations and is healthy to come into your home. And then, of course, we do more traditional background checks, references, and all of that. The other thing we do are supervision visits. So anybody who's coming into your home that comes from the Visiting Nurse Association is regularly supervised in a whole host of ways. And one of the things we're very proud of in Walpole is our patient satisfaction scores. Now, in home care, when you're paid by Medicare for providing those services, Medicare publishes all of your patient satisfaction scores and your clinical outcomes. They publish them so that anybody who wants to can go on to something called Home Health Compare, put in our agency name, and see how we do. And we're star rated. Medicare rates all the different agencies that they pay to provide services, and we're happy to say that we're out of 5 stars, we're 4-star rated, and have earned something called an elite agency from Strategic Health Partners. We've really achieved some outstanding scores for outcomes and for patient satisfaction.
Excellent. So I also like to just read off here something about your mission, your values, and your triple aim goal. So again, your mission is very simple: to be compassionate, high quality health care in your home. Your values are relationships with your patients, their caregivers, and the entire healthcare team. And then you have what's called our triple aim goal, which is to improve the care experience of your clients, to improve the health of the community at large, and to ensure efficiency of services provided to clients, which I believe is all great. Amy, to you, how are you trying to get this message out to the community and the public at large?
We do a lot of community events. We are participating in Walpole Day, and we do work very hard with our local physicians. We are preferred providers for the New England Quality Care Alliance and the group at Pondville Medical. We work closely with all of the area hospitals, the case managers, geriatric care managers, and people in the community that do refer patients. And we spend quite a bit of time in some of the local nursing homes and the Boston hospitals. So we work really closely with other aspects of the healthcare community to make sure that patients that want to go home can go home, and that patients understand that they do have a choice in choosing their home care.
And is it again related to your Medicaid or your Medicare as far as like even to the point of Part B or Part C? You know, the quality of your actual insurance, does it make a difference as far as what they'll pay for or what they won't pay for?
Do you want to take it?
All insurances are different. And so now we have Medicare HMOs. We have all sorts of, people can enroll in different kinds of Medicare products, depending upon what they enroll in. Or they could be, for example, they could be getting veterans benefits, depending upon what they enroll in and what they have. We investigate that for them. We help them to understand what's covered and what's not. And if there's something we don't provide, we connect them to it. That's a really big part of what we do, too, is connect people to things. We don't provide that for you, we'll help you get connected to it. So every insurance is different.
And not every agency accepts every insurance.
Right.
And is it based on a reimbursement process? Mm-hmm. So they'll go in, you'll go in and do services. The client or the person in need or their caregiver, like say a child or a spouse, will then take that and put that into insurance to be reimbursed. So are they paying for it up front and then be reimbursed, or just they're sending that bill directly to Medicaid, Medicare, and then they're paying you directly? Okay, great. Okay. Now, we talked a little bit how every VNA is not the same, mm-hmm. and what makes you guys unique. So what about, again, when it gets to the point of somebody that is over and above and it does fall to long-term care? I want to talk a little bit more about mm-hmm. that fine line. And typically it falls to the physician, who then will inform an insurance company by saying that this person needs long-term care, okay? So if you guys have somebody that's coming out of surgery, and then of course we know the hospitals want to get the patients out mm-hmm. as quickly as possible. So they're forced to the house and they're trying to battle back, and eventually they say, you know what, this is going to be more long-term than short-term. When does it switch from you guys to an actual long-term care need?
Part of what we do is, we talked about a nurse going out and caring for a wound, or a therapist going out and providing exercises, but we also do something called care management. When we're in the home with the patient, that nurse is called a nurse care manager. And her job is not only to make sure that all of those things are done that need to be done right there that are acute, but to help the patient and family to plan for what next. And that includes contacting the physician or contacting other community services and lining them up for what's next. So we tell patients right up front, in writing, this is what we're going to be doing now, and the physician approves that, and then we communicate in an ongoing fashion with the physician as we go along and help people to get connected to what they're going to need next. So if we're in there providing the nursing and the therapist and the home care aide, and they progress and they do really well, but they still need some help with some things, some housekeeping or whatever, we'll connect them to either a private agency or a state agency and help them to make that transition. We may be called back in if something happens where the patient has maybe a little setback, and they have a turn of events in terms of another diagnosis, and they need us to come back. Let's say they became diabetic. We would need to come back in to do some medication teaching, diet teaching. Those are the kinds of things that we do. So it's not a singular kind of thing where we just go in and take care of a wound, or even we do IV services, all sorts of acute services, but it's more of a care management. And Amy and her team are called care transition specialists because they help people transition from setting to setting. It goes way beyond just providing that service.
So I know with some of the insurance carriers, like there's a long-term care coordinator as
Yes.
well that's offered, and they're kind of like behind the scenes, of course. They're often some big high-rise or something trying to do everything via telephone and seeing or researching the information that's in front of them. So you guys are actually the ones that are on the front lines.
And
you
working
know.
with them.
Yes.
Giving them the
Okay.
information, paperwork, physician's orders, and interpreting that to the patient and family.
And we go out to the medical site. So my team actually goes and meets patients, whether they're at the nursing homes or in the hospitals. We have the opportunity to go and meet with patients at doctor's offices or wherever the acute episode has landed them. We have the opportunity to go meet with the patients and answer questions and let them know what to expect so that they can plan accordingly. And we work closely with families to make sure that the patients, when they do leave the setting that they're in and they do go home, they have everything that they need at home.
Yeah, I mean, goodness, I can only imagine if, like, say you were all by yourself, you know, if you didn't have a spouse or any kids around, and you're getting released back to your house, and you're like, what do I do
What do I
next? Or who's
do?
going to take care of me? You know, to the point where, you know, again, some of the long-term care services do the other things, like you said, housekeeping, paying the bills, you know, helping them take care of the medication or preparing the meals. That
And we
need to be
try,
done.
and before a patient does go home, we look at all of the aspects of the care and not just the medical piece. We want to make sure that the patient is safe and comfortable at home. So if they do have fears, we have an amazing nurse liaison that meets with the families. Deb Burnaby goes out and she'll talk to patients' families and make sure that every service that's available is offered so the patient can be home safely and soundly.
So you mentioned the nursing homes. As we can also know that, you know, a big part of our senior citizens have started to move into more senior living projects. And did they have their own services available, or are you actually going into those places as well?
Not into nursing homes, but we can go into other senior living options, so assisted livings or independent living, senior residence
Like
communities.
New Pond Village here
Yep,
in Walpole?
we absolutely can. We love the opportunity to service those patients. Many of them, many of those services are not provided at that level, contrary to popular belief. Even at the assisted living level, a lot of those services are not allowed. So one of the nice things is we're able, because of what we can provide, we're able to go into those and let patients stay in that environment as long as possible, typically until the end of life.
Okay. Now, let's talk about a little bit more about the community outreach part, okay? And you guys are doing a great job with that. I've seen you guys around town. Again, when we talked about some of the business development part, again, you're part of the Walpole Chamber. We appreciate that membership. You're going to a lot of those events, which is always great. A big part of being a member of the Chamber, I try to tell everybody, is it's just not just about writing a check. It's about getting out to the events, shaking hands, and getting to know the people that will potentially refer you business. And I was a couple of people that I've met along the way with the Walpole VNA, I've come to know, like, and trust, and as I'm doing with you guys. And I would know that if something ever happened to my mom, that I'd be able to make that call and know without a doubt that you guys are the people that I would be able to trust with my mother, you know?
Thank you.
So again, but big part of that is just not only knowing you personally, but seeing you out in the community, Walpole Day, some of the parades, different sponsorships that are being done throughout the year. You've done a lot of that, and it's great to see that. Where's the actual physical location? I know it's off of the downtown.
55 West Street.
Okay, so that's like
So
behind the main street?
Yes.
Okay, great.
Yes. And we even have a little clinic room there. Sometimes some of the people who need immunizations will come there. We have a teaching room because we're constantly trying to upgrade the skills of the staff that we have. And it's really nice to be right there in downtown Walpole.
And how many people do you employ?
We employ over 70 people.
Wow.
Yes.
Incredible.
So we're an employer. We bring that many people to the area. It's exciting. 70 and growing.
So that includes the blood pressure clinics that you just mentioned. So tell me a little bit about the Alzheimer's Caregiver Support Group.
So the Alzheimer's Caregiver Support Group is a volunteer activity. It's led by one of our nurses. In fact, it's led by our current public health nurse who's working over at Town Hall. And it's for folks who are trying to deal with a parent or loved one who has Alzheimer's, and they need a place to go where they can talk about their struggle with other people who know what that's like, and to get the support that they need, advice that they need, and just to be cared for a little bit.
Absolutely. And what's the telehealth program?
So our telehealth program is part of our actual program for how we care for people. Telehealth is when we bring a telehealth monitor into a patient's home, and we're able to monitor that patient, their blood pressure, their pulse, their what they call pulse oxygen level. The monitor actually asks the patients a series of questions that go along with what they're struggling with, whether it's heart disease or diabetes, and it monitors them daily and sends that information to our office. Once we get that information, we can make a decision about whether or not they need a visit that day. Their physician needs to be called. So instead of sending a nurse out every day, we're able to monitor the patient every day and go in when we're needed, in addition to our regular visits. The whole idea, again, is to keep people at home and to keep them out of being re-hospitalized.
That's excellent. So I just got the signal we're winding down.
Okay.
I bet that went pretty quick.
It was fun.
But
Thank you.
I just like to stress the importance of the work that you guys do. And I can imagine that if you could give a message to the general public, I think that would be that you need to properly plan and expect that this is going to be something that's going to happen within every family.
Everyone.
And to either plan accordingly by making sure you have the right insurance coverages, or making sure that you have potential long-term care insurance. But I think more importantly, it's getting the family together and to make sure that people are going to be able to lend a hand, help make decisions, and make sure that all of the decisions that are made for the single purpose of helping that one person in need. So I thank you very much for your time.
Thank you for this opportunity.
Again, you guys do a great service for the community. You have a great company. And again, I'd like to thank everyone for watching today. Again, great company, great show, great message. Again, it's all about getting this information out to the public so you guys can make informed decisions and work with businesses and professionals that you come to know, like, and trust. I thank you again, and have a great day.